It is known that hand hygiene is one essential way to reduce the spread of overall infection rates in healthcare settings. However, personal equipment such as stethoscopes can pose a risk for transmitting bacteria from patient to patient, especially in a hospital setting. In the U.S., the CDC identifies that nearly 1.7 million hospitalized patients annually acquire HCAIs while being treated for other health issues, and that more than 98,000 patients die due to these. Healthcare providers should always clean and disinfect the stethoscope that will be used for examination, as multiple studies have shown that stethoscope diaphragms and tubing carry microorganisms which can be transferred from patient to patient throughout the nurse's workday. Nurses working in hospital units that care for vulnerable patient populations can inadvertently transfer contamination after touching their stethoscope earpieces with hands and then touching their patients.
Although the majority of respondents frequently used a stethoscope at work and almost all believe that stethoscopes can be involved in pathogen transmission, only 29% of participants reported cleaning their stethoscopes after every use. Furthermore, another recent study that looked at stethoscope cleaning practices done in a hospital showed 53% of the 62 participants had never cleaned their stethoscope. In one case, a nurse who was suffering from otitis externa infection and MRSA allegedly infected a couple of her neonatal patients after touching her earpieces and then the babies. One study, when subjected to common microbiology testing, 59% of stethoscopes were found to carry pathogenic bacteria. Acinetobacter was in the lead, appearing on 39% of contaminated stethoscopes, followed closely by Klebsiella pneumoniae. Several techniques to disinfect a stethoscope, which can include alcohol swabs, hydrogen peroxide wipes, and alcohol-based hand rubs, to name a few. Let's go back to our nurse who forgot to clean her stethoscope in between patients and look at where she can implement stethoscope hygiene.
Room and washing my hands, I would then proceed to clean my stethoscope prior to touching the patient.
With listening to your heart and getting your heartbeat.
Right after finishing up with the patient, I will do my hand hygiene, and I will also remember to clean my stethoscope.
This time, the nurse followed the CDC's recommendations for appropriate stethoscope hygiene. Studies show that stethoscope hygiene adherence is generally low, so why is that the case? A survey done on clinicians' beliefs of stethoscope hygiene found that forgetfulness, time constraints, and limited access to supplies were perceived barriers.
As you can see, it's really important to clean your stethoscope before and after each patient. There are many ways to cut down on the spread of infection through a stethoscope. The easiest and best option right now is to use alcohol wipes to clean the bell and diaphragm before and after each use. So you clean the diaphragm and the bell. Otherwise, if you have a tunable diaphragm, you'll remove it from the chest piece, wipe it down with alcohol, or wash it in a sink with soap and water. Also, remove the earpieces from each day and clean them, dry them, and leave them here before snapping them back onto the ribbed ends of the ear tubes. During patient visits, it would also be a good idea to use disposable stethoscope covers as such. You put the stethoscope in, you close it, you listen, you take it off, and throw it away. We would like the hospitals and outpatient clinics to start placing alcohol wipes next to the Purell outside the patient room, as well as next to the sink inside the patient's room, to help staff to remember to clean their stethoscopes in between patients.